So nominal is my categories, groups, gender, sex, things like that. Ordinal, order, first, second, third, fourth, right? Those both are used for qualitative data. Qualitative data are surveys. Qualitative data are when you hang up from AT&T and they said, will you please fill out this 3-question survey? Okay. Qualitative data, quality. I'm looking for a correlation, a relationship between your event as well as your how you feel, right? Okay. So the other two is interval and ratio. So interval is time. Interval is the measurements on your clock or the measurements on your thermometer that are the same distance apart. So I'm just muting people, guys. Somebody came in, mute yourself. Okay. So what I know is that my interval is the same distance apart. So it's going to be, you know, every 1 minute like a clock or every degree on a thermometer. So intervals are set time periods. Ratio is out of 10 people, 3 out of 10 people like this. Okay. The only thing that can have a true zero is my ratio. So my ratio to have a true zero means that out of 10 people, nobody liked it. All right. That's the only one that can have a true zero. So in general, when you're looking at, okay, somebody's going to mute themselves. I can't figure out who it is and why I hear it. There we go. Got it. Okay, so anyway, my interval is the one, my ratio is the only one that has the true zero. So then when it comes to fixed ratio and fixed intervals, the fixed ratios, or the interval schedule is what it's called. Okay, can everybody see who, if you're muted? If I'm looking down and I cannot see who's not on my page. Okay, thank you much. Okay. So then my schedule of intervals, the scheduling, what that looks like is that I am determining which is let me try that again. So the most difficult one to break is my interval that is variable, okay? Because I never know when it's going to happen. That is the most difficult one to break. Share my screen again. That's why I gamble, because you never know. This time's going to be the one time, right? And I apologize, I also only have one screen today. Usually I have 2 screens, but I cracked it on the way down. I didn't really crack it. My daughter's dog sat on it and cracked it. Okay, can you see my screen?
Yes, yeah.
Oh, variable, rate, fixed, and all. You see that? Yes. So my variable ratio, so remember ratio is the one that has the true zero. That's the numbers, right? Okay. So then variable ratio means this time you'll get it 3 times, next time you'll get it 6 times, next time you'll get it on the 8th time, right? I never know when I'm going to get it. That is every 3rd time, every 7th time. A fixed ratio is every single time, okay? So if every single time I speed, I got a ticket, would I not stop? Exactly. Maybe you wouldn't, but I think I would. So that's my fix, okay? Because if every single time it happens, my behavior is not going to continue. A variable ratio, if it only happens every so times, then I'm going to keep doing it. So if the first time I'm going 65 before I get a ticket, and the next time he pulls me over at 85, and the next time, I'm going 5 miles over the speed limit, then my odds are pretty good that I'm going to keep doing it because it's a variable. The fix is always going to be the same. Every time I go over 55, I'm going to get a ding. Okay? My variable interval, so remember interval is time. Okay, so that means that every certain time, I'm going to do it. So, okay, so if it's fixed, it's every 5 minutes, right? Every 5 minutes, every 5 minutes, every 5 minutes. When you're trying to potty train a kid or a dog, like you should have a set schedule, like every hour he goes out, that's fixed. Variable means whenever you feel like it. So this time it's every hour, the next time it's every hour and a half, etc. Okay? So that's my variable interval. So when I am trying to have a kid I'm trying to have a kid learn to be potty trained, okay, then I'm going to do continuous reinforcement, right? Every time he potties, we get the pee-pee dance and the high five, yay, yay! Because I'm really trying to train that behavior. And that's called shaping, by the way, right? Because shaping is when I reward him as he gets closer to the behavior. Does that answer that question?
Yes, thank you so much.
Okay. While I'm here, then we'll go ahead and do that reinforcement that everybody loves, negative and positive reinforcement. Okay, can you see my operant conditioning?
Yes.
Okay, so then someone be brave and explain to me how positive and negative reinforcement work. Come on, come on. I know somebody knows. Okay, fine. So my positive reinforcement, okay? I like anything I like, I want to continue happening, right? So if I like the behavior that's going on, I like what my client is doing, I like what my husband is doing, I'm going to do something to continue that behavior, right? So then, use the same analogy. So if you've had me before, so you know what, your spouse, your significant other, never cooks dinner, never, 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 and you've asked them a couple times and they don't. And this time they've decided they're going to cook dinner, right? You're thrilled. Oh my gosh, I came home and there's dinner. So then I am looking for a way to reinforce that behavior. I like it. I want to happen again. So what would I give him positive? What can I give him to reinforce that behavior? Give her, my significant other, what can I give them? Okay, all of you with your perfect spouses that have perfect lives. But for those of us who didn't, or weren't perfect spouses, you know what? Give me something I like. Give me a kiss. Give me a trip to the bedroom. Give me a new dress. Give me something, right? My behavior is going to continue. You're going to add something on, and my behavior is going to continue because you gave me something I like. Negative reinforcement is taking away something that I don't like. Okay? So then, same kind of thing. Your partner you came home, and your partner they cleaned up, they made dinner, and you're so thrilled. Oh my gosh, honey, I love you. I can't believe you did this. So you're going to this time take away something the partner doesn't like. So you're removing a negative stimuli, something he didn't want to do anyway. Oh my gosh, honey, you made dinner today. You know what? I won't complain all weekend. I'll let you watch the football game. I'll take out the trash. That was normally your job. Any of those things that he doesn't or she doesn't like it anyway, I'm removing. That's a negative reinforcement. Okay, so remember, reinforcement is always going to increase behavior. It's either going to increase behavior by adding something, right? Or by taking something away. Okay, so adding something or taking something away. Does that make sense? Well, sure. Okay, so in my punishment, same sort of thing. Punishment is that I don't like the behavior. I'm stopping the behavior. I want it to stop immediately. Okay, so one of the things I can do to stop behavior is really then to make sure that I add something they don't like, or I take away something they do like. So your kid does a great job doing his homework most of the time, but this week he just hasn't done his homework. Oh my gosh, I can't believe you, Johnny, you haven't done your homework. So positive punishment is giving Johnny something, right? So I'm giving Johnny punishment. I can give him a dirty look. I can give him a smack on the face. I can give him timeout. Someone told me one time you can make him eat broccoli. Anything you're going to add on as punishment. And then negative punishment is taking away something that he likes. I'm removing a positive stimuli. That's why we buy the PlayStation and the phone and all that good stuff you're going to buy for Christmas, right? You can take it away when they're not doing what they're supposed to be doing. So when you're looking at those questions, you're going to remember when it's reinforcement, I am trying to increase the behavior. I really like it. I want it to continue. I'm trying to increase it. When it comes to stopping the behavior, right? I do not like what's going on, so I'm going to try to stop the behavior, and that is punishment. And I'm either going to stop it by adding something or taking away something, right? Of course. Okay. I hope that cleared up just a little bit. A lot of people struggle with that. More questions, guys? You can hear me, right?
Yeah, we can hear you. I can hear you.
Making sure. I thought maybe I'm like talking to the air today. And
no, we can hear you. Yeah. Yeah. Mm-hmm.
Okay. Other questions? So most often when I talk about, we're doing code of ethics today, and what I hear all the time is, oh my gosh, I do so awful on the code of ethics in Pocket Prep, because in the code of ethics, there are those statistics questions also, right? Like, oh my gosh, if you're doing Pocket Prep and you're wondering why you're scoring so low, that's because now those statistic problems are under there as well. So we'll talk about, in general, some of our code of ethics questions. That will include the research ones. I did a separate session on research. So. Pull up. In general, when it comes to the code of ethics, I strongly suggest that you read them. Okay, so there are just some things in there. Some of those questions are verbatim when it comes to the code of ethics. Pull it up, and so the most recent one is the 2014. So some of the ones that people always get confused at. So can I take a gift? Well, yes, I can take a gift. It depends on, right? Okay, so it really depends on what's going on with the client. Okay, so I strongly suggest that you know these terms. I hear a lot of people like, I'm not really sure what those are when it comes to your the issues with your ethical, your professional values. Okay, the fundamental principles: autonomy, right? That means the client has the right to make their own choices. Non-malfeasance. That means we're not going to do anything purposely to harm our client. Benefice. I'm going to do what's good for not only my client, but also for the betterment of society. Justice. That's social justice. I'm going to do the right thing for everybody. It's not fair that some people get this and other people get that because they live on the wrong side of the street or because of their skin color. I'm always fighting for justice. Fidelity and veracity. Those were in your wedding vows, maybe not in those words, but it means faithful and true, right? Faithful, fidelity, I will keep my honor, I'll keep my word, I'll keep my promises. And veracity means that I'll deal with you truthfully. Okay, so faithful and true. So, and that's, if it didn't work out for you in your wedding vows, I'm sorry, but that's what we're looking at. So those are those important principles. And that's what those are important to know what those mean and to know that you'll see those often on the test. Okay, so in general, informed consent. I want to give informed consent because I want the client to know before they tell me anything that not everything they tell me I can keep to myself, right? So of course I'm telling them about, the rules and what to expect and the rules of confidentiality, all that good stuff. But one of the main reasons I'm telling you up front is because before you start talking and you tell me how you killed somebody or you're about to kill somebody, you need to know that I cannot keep that a secret, right? Now, the truth is, if you tell me that you already killed somebody and no one is in danger, then I can't share that. But keep that with me. But if you tell me you're going to kill somebody, I'd have to share that. Okay. Mandated clients. It clearly talks about what to do. Okay. So I'm going to offer the client the services. I'm going to tell the client the services that I offer and then remind them of the consequences. Right. So counselors also explain what type of information with whom the information is going to be shared with prior to the beginning of counseling. I'm under A2E, mandated clients. In this case, counselors will, to the best of their ability, discuss with the client the potential consequences for refusing services. So I'm going to, again, have a client who's mandated or ordered and they don't want to be here, right? Then I'm going to say to them, these are the services that I offer. And these are the consequences, or, remind them of the consequences if they choose not to. They have that right. I can't make anyone do anything. When can you sleep with your clients, guys?
Never.
Oh, a current client, never. But what if you're done with them? 5.
How long ago have I been done with them?
5 years.
Yep.
5 years. 5 years. And you are correct. Never, 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 never with a current client. That is not acceptable. No, a current client is always, always no. But what? Is that flame still growing? Yes. You've been waiting that 5 years. Go right ahead, right? However, do know that it talks about you can't have kept the conversation going during that 5 years. And also, you have to make sure that it's not exploitive, that you're not taking advantage of that client. Okay? Members and family members, friends or family members, I always say, if you've seen them naked, don't treat. That's when you refer out. That's a spouse, a former spouse, a cousin, a grandmother who watched you, a friend who you grew up with. If they've seen you naked, even if you were 2, don't treat them, right? Let them go. That's when it's really okay to refer out. You cannot treat, even if it's a rule setting and you're the only one out there, still don't treat. Okay. When it comes to bartering, is bartering okay? The client has to recommend it, has to suggest it, and it has to be what everybody in the town takes. So if the doctor takes eggs, chicken eggs, and you can take chicken eggs too. If the doctor doesn't take chicken eggs, then you can't. Okay, so the client has to recommend it, and then also it has to be the arrangement that is acceptable in the area. And many times in rural areas, that is acceptable. Okay, so that is the rule. So in the question, you'll see it verbatim, right? So the client has to request it, and then it can't exploit the client either. Okay. Back up here, receiving gifts. We talked about that. It doesn't say you can't. Understand the challenges. So you're going to look at the cultural aspect of the client. You're going to look at the respect and the token of respect and gratitude. Okay, take into consideration therapeutic relationship, the monetary value, the client's motivation for the gift, and the counselor's motivation wanting to accept the gift. So the question that says, can you take a gift? It depends on, right? Now, if a client offers you, like, season tickets to your favorite football game, I have to tell you this, that's still going to be a no. I don't care what his rationale was, that's just not going to be okay. So you always want to avoid the look of impropriety, right? So always be above board, but definitely you want to just, look at the reason. And many times you'll say something about the client's cultural background. You always want to take that into. Okay. You can't leave your client. Sorry, you can't abandon them just because you don't like them. Doesn't work. Sorry, you're stuck with them. If counter-transference or transference gets in the way, first you're going to try to do is work that out with your supervisor, right? And then or consultation. And then after several times, if you've gone through some consultation, then it's okay to refer them out. Okay, but you can't just refer them out because you don't like them. It doesn't work that way. If the client doesn't pay their fees, you know what you have to do, right? Come up with come with a price that you can both live with. If the client then can't afford that, if they've agreed to it and they still can't afford it, then I can terminate them and send them to community mental health as long as they're not in danger, right? And when it comes to that, making sure that you are the fees have to be reasonable for you too. If your normal rate is $2.25 an hour, then don't be expected to take $50 an hour. That's not what the Code of Ethics says. It's not saying that you have to be poor to make sure your clients are happy. Not at all. Also, non-payment of fees. So if you plan to use a collection agency, if they don't pay, the client needs to know that up front. Okay. So there's issues with when I can report, when I can't report, right? Okay, so foreseeable and serious and foreseeable harm or legal requirements, remember. So if you tell me you're going to hurt yourself or hurt someone else, I have to report. If you are, if you're telling me that if the client tells me that her father molested her and she is still underage, that is illegal. I have to report that legally. If she is 21 and she tells me it happened when she was 6, that is something I cannot report. I'm going to encourage her to report, but I cannot report, right? Because at this point, no one is in imminent danger. If the question does say, though, that she's dropping her 5-year-old daughter along with her dad that used to molest her, then that's a problem, right? But so if it is, if she is an adult now, again, that's a police matter, and I'm going to encourage her, but I cannot share that. Minimal disclosure, guys. In general, we're not supposed to disclose, right? We're supposed to just minimal do self-disclosure. That AIDS question, of course, is right there, and it's sort of, we're going to see COVID there in the future, but right now, it says the answer is to adhere to the relevant state laws concerning disclosure of disease status. Okay, in there it does say you may be. Okay, here we go. So prior to making a disclosure, Clients assess the intent of clients to inform the third party about the disease or to engage in any behaviors that may be harmful to the identifiable party. Okay, so I may be justified. So counselors may be justified, but you may not be either. Okay, so follow your state and local guidelines. In the real world, follow your agency guidelines. If you're in private practice, then seek consultation, and that's the only decision you can make. But because we have not had a case that's gone to the Supreme Court, we're really not sure how this is going to end up. That's a legal issue. That's something that the mental health field hasn't tackled yet. So you may be, and I do think, with COVID, we're going to see that same kind of thing. With regards to court, right? You get subpoenaed to court. What do? You just show up and turn over all your records, right? No. When ordered by court to release confidential or privileged information is the legal term, right? That is the legal term. That means the same thing. So I will see privilege when it's court. So any other time, that's not the right answer, because the other term is going to be then confidentiality. So without the client's permission, counselors seek to obtain written, informed consent from the client or take steps to prohibit the disclosure or have it limited as narrowly as possible because of the potential harm to the client, right? All that means is I'm going to say, Your Honor, please don't look at this whole thing. This is information that was given to me in privilege, and I really, really would prefer that we not share that. My client had no intention of this being an open court, right? And then even if you do, if you're going to take it, then please don't look through the whole thing. Just look through those few days that you're talking about. Group work, things to stay in group, right? Families and groups are the same. Same as a couple. I can't see a couple together and then see one of them separately. So if a couple comes in and she has issues with, or he has issues that are personal that may be related to the couple, I can send him out and still see them as a couple together. All right. Can clients see their records?
They can.
Always?
At my agency, they can.
Oh, is that what the test question asked?
I'm sorry, can you repeat that?
I was being a smart aleck.
Oh.
Is that what the test says? At your agency? I wish it worked that way. I'm sorry. It doesn't. So, are there no stipulations to that?
We try and make sure that they have a legitimate reason for seeing their records. Most times it's for court, in which we really, really try and work with them not to release the records. But if they insist on having their records, we'll give them a copy of their records.
So that is your agency policy. That is not what the Code of Ethics says. Yeah. Mm-hmm. Okay. So first of all, they're my records, or not the client's records. Like if you go to get records from your doctor, right? He's going to give you a copy, but they're his records to begin with. So remember, they are your records, not the client. So then, if I have no reason whatsoever to have any concerns, then I'm going to say, sure, here you are, no problem, right? However, if I think that there's something they won't understand, I've written it in like, therapeutic ease, or I've thrown in some like defense mechanisms, things I think they won't understand, but I'm going to call them in and interpret it. You help them understand what those records mean. But if I think that part of the records will be harmful to them or me or anyone else, I have the right to keep all or part of the records. I just need a document. Okay. So an example I've seen on the chat, or a question, is your client is court ordered, and he wants to see a copy of his records before going to court. Right. So as long as there's nothing in there that you think would be harmful to the client, then sure, I'm going to show him his records. However, if my records to the court say something like, I don't think you should get his kid back because he's a sociopath or antisocial behavior, then I'm not showing him those records, right? He's going to kill me before we even get to court. So I have the right to protect. If I think they're going to endanger him or myself, then I have the right to keep all or part of the records. I just have to document. Okay. And that's assistance with records, right? When clients request access to their records, counselors provide assistance and consultation in interpreting the counseling. That's B6F. How long do you have to keep those records? Every state has different laws, right? So most states, it's here 7, 5, whatever. The answer is, depending on your state law, follow the state and local jurisdiction. Sexual harassment, you cannot hang your picture of half-naked man on the wall, guys. Sorry, it's not appropriate. Keep it home. Anything in particular about the Code of Ethics that you want to ask me?
Dr. Pam.
Yes.
In the Code of Ethics, can you go over consultee and consult?
So what's the difference between consultation and supervision?
Supervision, you have to have the release signed because that person might not be with your agency, or are you referring to that?
So what's the difference between having clinical supervision and having consultation, or having your boss who works for the agency? What's the difference between that and supervision?
Oh, supervision is covering all your clients.
Okay.
And you're also getting assistance.
Okay. So then when it comes to the consultation, then that person most often is outside of my agency, or I'm paying them, right?
Yes.
Okay, so if I'm in private practice, or if I am, even if my agency hires someone, okay? So do I have to have different permission than I would with supervision if I use consultation?
Yeah.
Yeah, right? So can I just share my, so when it comes to supervision in general, especially when you're new, do you tell your clients that this information will be shared with their supervisor?
I do.
Does the Code of Ethics say that you should? Yes. So many times it's part of the paperwork that you sign when you come in. But yes, so that's part of the agency, and your client should know that you are under supervision and that the information is going out. That's usually part of like the paperwork of the agency. But a consultation is someone outside the agency. So most often that's a separate form to make sure that the client is aware that someone from outside the agency is also going to be looking at their records or guiding you as part of that. So yes, you have to have a release for that. Did that answer that question?
Yes.
This one. So forensic evaluation for legal proceedings. So the forensic evaluation is when you are called in to look at the person, to evaluate them at the time that they were, when they did the crime, when they completed a crime. I'm looking at their mindset, where they were when they committed the crime. So if I have a prior relationship with that client, I cannot be a forensic evaluator. So if you've ever called in, or you see a question about being called into a forensic interview, you cannot do that if you already have a relationship with the client, because we are more likely to be biased. I can bring in some of my past stuff, right? I always knew Johnny was no good. I always knew he was going to do something like that. Or not Johnny, he would never do anything like that. right? Other questions, guys? I'm going to pull up some questions, but tell me something, anything else in particular that you've seen anywhere? Here. Share my screen. Okay. Like, oh my God, it's one of those research questions in there. I can't do this. No, no, no. Right? I won't even do that to you. I'm just going to skip it. That one. Their code of ethics. Look at that one. Certification is specified as a process by which the NBCC does what?
Something happened to the screen. I didn't see the question.
Ah, thank you.
The question's gone.
Thank you, thank you. Let me go back and share again. I appreciate that. See it now?
Yes.
Okay. So these questions are tougher, by the way. Okay, and so what we're looking for is to rule out what it can't be. Right, so rule out the ones that it can't be. So I'm looking at certification by the NBCC, right? So I can only see one screen at a time, so you're just going to have to shout out for me as opposed to writing it in my thing.
Okay.
Is it B?
You have 2 for C so far.
2 for C and 1 for B.
Yes.
So which am I going with? B. Ding, 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 ding. which of the following statement best expresses the major flaw of the doctor-patient model of consultation? You tell me if I can't see my chat box.
Is it C?
See? Ding, 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 ding. Okay, so the doctor-patient model, okay, so most often that's like the medical model, right? You come in, you go to the doctor, you tell him what's wrong, and he fixes it, or he gives you some idea to fix it. So the doctor-patient model of consultation to work, the patient, the consultee, must be willing to accept and implement the prescription the idea suggests, okay? Do we always have to implement what the consultee says? Or the consultant? We do not, right? We do not. So they come in and they're going to share some thoughts and some ideas with us, but we don't have to take it, right? And in fact, if it's something that's unethical, you should not take it, right? So a consultant is paid to come in and you know, usually by the hour and kind of tell you what their thoughts are and you know, their suggestions, but you don't have to implement them. Okay. Okay, let's try that one again. Look at that. So which of the following models of consultation would be appropriate for a consultant attempting to modify the behavior of a consultee's client? See a D. And what D? Ding, 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 right? The educational approach, teaching, right? We already talked about the doctor-patient model, and that's probably not the best one. Got it. Good, good. Now, we should know this one. This is one of those easy questions with my skew. So remember when I'm doing a skew, mode, median, and so in a normal bell curve, my 68, 95, and 99 rule, normal bell curve, mode, median, and mean are all the same number, right? The mean is the actual average. The mode is the number that appears the most often, and the median is the number in the exact middle. So on a perfect bell curve, the 68, 95, 99 rule, everything's lined up perfectly, and all three of those are the same. However, if they are not the same number, what I do know is the mode is going to be the highest point, right? Because the mode is the number that appears the most. Okay, so that is the highest point. So then what I'm looking for is the mean controls the direction, right? The mean guy controls the direction. So which of the following is true? Come on, be brave here. D. In a positively skewed distribution, the mode will be higher than the mean. So the mode is the highest point, right? No matter what. So the mode is going to, the mean is what pulls the mode, pulls the curve, right? So if the mean is the higher one, then the mean is going to pull it to the positive side, right? That's a positive, like the number line. If the mean is lower than the mode, okay, then it's going to be a negative skew, right? Unfortunately, the median doesn't have a huge role. What I'm always looking for is the mode, okay? So in a positive distribution, the mode will be higher than the mean. If the mean is lower than the mode, it's going to be a negative distribution, doesn't it? Let me show you an example, okay, of my positive and negative skew. The mean guy is always in charge, right? So remember that. He's the one that makes the decision of which way it goes. You see my skew? Yes, we see your skew. No, we don't see your skew.
Yes.
Thank you. Thank you very much. So normally I have two screens, and this is hard for me with just one screen. Okay, so mode is always on top, right?
Yeah.
Okay, so mode is always got. So that's the one, ice cream a la mode. Remember that. Okay, so that's the one that's always going to be right there on top. So then my median, that really doesn't have a lot of say-so, but the median is the one that gives me the least amount of information. Okay, so but if the median still is lower than the mode, it's a negative skew, right? If it's higher than the mode, it's a positive skew. So the mode is still going to be at the top, right? That's the one that's going to set the curve. And then depending on if the mean is higher, or the median is higher, a higher number. So for example, if I'm a teacher, right, and I have 12 kids in my class, and 6 of the kids score a 50 on the test. That's the mode, right? Because that's the one that the most kids scored. However, if my average of the class was 70, that means the mean is 70, and is higher than the mode, which was the ones where the kids scored the most. That is a positive skew, right? So on the other hand, so same thing, my mode, that's the number of kids. So the mode still, everybody, there's like 6 kids that scored, there's 6 kids that scored like 100 on the test, right? Like they must have cheated because the class average is only 50. So if the mean is less than the mode, A, I'm extremely suspicious, and B, it's that negative skew, okay? Because the mean is less than the mode, okay? Okay, ask me questions. So when it comes to research, this is one of the easier ones, okay? So those 3 terms, mode, that's the number that appears the most often. So if I have, in my set of numbers, if I have like, 3 threes and 4, 3 threes, a 6, 7, 8, 9, the mode is again the number that appears the most often. Mean is the exact average. Median is the green. That's the grass in the middle. I always remember. That's what's in the exact middle. And the median gives me the least amount of information. And get it out of your head that research is hard, because it is really not that hard. Okay, and sometimes I think my clients have this mental block because you had this awful teacher when you were in college, and it's not. It is really not that hard. What I explained to you, if you think about it, all I'm saying is ice cream a la mode. The mode is on top, right? Let's go back to the question then. Okay, we're back at my question. Okay, so in a positive skew, remember the mode is on top, right? So if the median is higher than the mode, that would be a positive skew, right?
Is it D?
Okay. You understand why it's A? Okay. So what I know is in a positively skewed distribution, right? That means they're going toward the higher numbers, right? So I know that the median is higher than the mode. The mode is lower. So if the mode is 50 and the median is 70, that's a positive skew, because the median is higher than the mode. You'll see the word also central tendency, and central tendency is the same as the middle.
Can you put that question and answer in the chat?
I can. in it also. Okay. So the key to remember is the mode is always going to is the highest point, right? And then the mean or the median is going to determine which way it goes because the mode is the highest point because it appears more than once. Okay, ice cream a la mode. Okay. Windows here, go back to my questions. You see this one, 179? Yes, you can see it.
We can see it.
Thank you much.
Is it B?
Okay. The Hawthorne effect says that people work harder when they are being watched, right? Ding, 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 ding. So my halo effect is the fact that we are more likely to believe people who are attractive or smart, the vacuum cleaner salesman, like all of those people. We're like, oh, okay. Whatever he says, I'm going to buy, right? The halo effect is also when you leave a really good dinner and they ask you to fill out the coupon, the survey right there, right? Because that was really, really good, and later on you might remember, well, I did really like this part, but at that moment it feels really good, so you're going to give it a real positive answer, right? Okay, and then my Rosenthal effect is the same as the Pygmalion effect. They know what that is? Has nothing to do with the actual Rosenthal guy. So what that means is that I'm going to find what I'm looking for. Okay. So whatever I'm looking for is what I'm going to find. That's called the Pygmalion or the Rosenthal effect. Okay. Okay. So this is a program evaluation question. What I know is that At the end of any kind of agency kind of program, there's a summative, which is a summary of like how it happened, or what happened, and the formative is when that's the process, evaluating it in the process. Okay, I heard some things come up there. Okay. Program evaluation intended to determine the answer to a factual question rather than driven by a theoretical concern. I don't know if program is, I don't know if that's factual. We chose A, is that our best choice there? A, B, and C are all true. Okay. Oh, know about program evaluation. What would be one of the most important steps to conduct early in planning a program evaluation? Okay, so one of the things that whenever I'm being evaluated on, do I not want to know the criteria that you're evaluating me on? Do you want to find out at the end of the the end of the term? Oh, by the way, no, it wasn't about your work. I was really evaluating you on this. Like, whoa. I want to know early what I'm being evaluated on, right? Okay. Identify, involve all the stakeholders. So that means the clients, the people around you, all of those things, right? Okay. Go down and do some of this treatment planning once, guys. Let's be brave here. A consultant is providing consultation to a hospital with the goal of creating a greater sense of emotional well-being among hospital employees. This is most likely what kind of consultation? educational, behavioral, systems, and mental health. Consultation to a hospital. Hello, hello, be brave.
You have a lot of D's in the chat box.
Thank you very much. Very good. Thank you, thank you. Mental health, you got it. Good, good. For individuals suffering from agoraphobia, a therapist believes that group treatment is more effective than the individual treatment. What would be the best way to investigate this belief? Agoraphobia, remember, those are people who don't like to leave their house. They will leave their house, by the way. So if you see those questions, don't think they don't, because they will leave their house. What is the best way to investigate the belief?
B.
Thank you. Okay, so C, randomly assign agoraphobic subjects to either group or individual treatment. Let's go back to the question, right? Okay, so the individual suffering from agoraphobia, therapist believes that group treatment is more effective than individual. So those are my two types. So I'm looking at how I'm going to find. So let's look at B. Compare agoraphobics who are currently receiving group treatment to those who are receiving individual treatment. That makes sense. But to do a true experiment, they have to be randomized. That's what they were looking for, a true experiment. Remember, a quasi-experiment is not randomized, and a quasi-experiment is always going to be the right answer when it comes to doing a program evaluation, right? How I evaluate the program is based on that when I do a program evaluation, it's got to be quasi-experimental because it cannot be random. Because if someone's coming in for treatment, I can't randomly just decide, oh, by the way, yeah, we're going to give you the placebo when they think they're coming in for treatment. Right? Okay. Transactional analysis, that is my TA, right? That is that parent-child ego, parent-child and adult, the three ego states. The goal of transactional analysis is
C.
Well, he said that we all have those ego states. So the answer would be to work without the scripts. Okay. So he said those were the scripts, the roles that we were playing. He said games were dangerous, right? With that parent-child, as long as we were coming from, we should both always becoming adult to adult, right? I'm the adult, you're the adult, and that's what we should be becoming. Each relating to each other. However, a complementary state would be, so maybe it is I'm sick and my spouse is taking care of me. That's really okay, right? If he stays in he's sick and I'm taking care of him. That's occasionally, that's okay, right? However, if it happens often, then that's not okay. And those are one of those cross transactions. And the worst, of course, are those the hidden ones, right? We talk about the games people play of how they relate to each other. That's TA. Right? This question about group strategies. Which of the following is the least important consideration or selection of appropriate group strategies? When I'm looking at a least, I'm always looking at knowing 3 of those are really important and 1 is not. Which is the least important? I'm seeing a C. I think that's okay. Ding, 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 ding. Right? So it doesn't matter. Each group is different, right? So the previous the time that you've had in group doesn't really matter. It would be most appropriate to use a warm-up period with a client who is.
See?
Ding, 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 right. I go in and start just doing what I need to do, and he doesn't want to be there anyway. Oh my goodness, right? Perfect. Good, good. A new client reports that he has been experiencing problems with sexual function since he started taking antidepressant medication. He's upset about the problem. The counselor's best intervention is, okay? So that is a normal side effect, right? So we know that many of the antidepressants were actually used for premature ejaculation when they first came out. So that is a normal side effect. The question is, what do we do with that?
B.
And why?
Because we didn't prescribe it.
That's not in our lane, right?
Right.
Did I miss today in med school?
Still waiting on that license as well.
That's when you can gamble, right?
Stop it.
I was just making sure. So what was my answer? What did you say, B or C?
B.
Ding, ding, ding. Okay. And it is, and I can share with him that because definitely that is a normal side effect. However, again, that's out of my lane. The beginning of the counseling process would be most appropriate for a counselor to self-disclose. And I think in general, we're taught the least self-disclosure, the better, right? B, is that what I'm hearing there? Low, moderate level to reduce client's defensiveness. Ding, ding, ding. Right? So self-disclosure really as minimal as possible. Okay. And also just making sure, looking at a rationale, is it really about what's best for us or what's best for the client? Okay. Do you know what primary, secondary, and tertiary prevention the states are? So primary prevention is we're trying to make sure people don't get it, whatever it is, we're trying to make sure that you don't get it. So whether it is like COVID right now, right? The primary prevention is stay home. Don't go to your family's house for Thanksgiving, right? Mask, wash your hands, all of those things, we're trying to prevent it. That's primary prevention. It goes to everybody. Secondary prevention is now you've been exposed, right? You went ahead and went to granny's anyway, and now everybody's exposed. So what you're going to do is you're going to isolate yourself for 14 days. I think the CDC is they're going to reduce it maybe from 7 to 10 days, etc. Tertiary prevention is now you've got it. You got full-blown COVID, and we're doing what we can to keep you alive and also to keep you from spreading it to others, right? So then, you're developing a program for preschool children who are at risk for learning disabilities. See A. So if they're at risk, so my primary would be for everybody, right? Is every kid at risk for learning disabilities? Oh, it is A. It's primary. So I'm getting, it's a program for preschool children who are at risk for learning disabilities. So the assumption is that I'm going to stop it before it gets there. So that is a primary prevention. Sharon, I think you were right on that one. Ding, ding, ding. Sorry, I didn't ring my bell.
Thank you.
When I travel, okay? I'll remember to bring my bell. We set up a program for inmates who are leaving prison in order to lower recidivism rates. This is an example of what? Oh, I see a B. That is tertiary. Why? Because they're already in prison, aren't they? right? They already have it. So, you know, the Scared Straight, like those are the programs that we're trying to keep kids out of prison, right? But this one, you know, they're already out and they're already gone through. So I'm trying to lower the recidivism rate. That is tertiary. Well, I mentioned this earlier. A summative program evaluation is the end. That's the sum of the program. It's going to be so I'm looking at the end of the program. Okay. So if someone says, oh, you know, you did a really great job with that program over there, I'd like to duplicate it. I wonder if we could, you know, try that. I'm going to give them the summative, the end, right? The formative is as we're still going on, because the formative we can definitely, you know, change halfway through if this isn't working out for us. But the sum is the summary. When planning a program, the first step entailing defining the problems, and the second step entails and this one, I would probably just put them in order. Got a D, determine how the program will operate. I've defined the problems. Okay, I'm going to set the goals, right? How do I measure? How do I know if we're successful? I have to have measurable goals, right? Okay. I don't know. Better get that primary, secondary, and tertiary right, because this seems to be like the third question on this one, right? Got an A. Secondary. Okay, that's my secondary. Very good. Okay, one more, guys. community intervention program designed to reduce drug abuse. It is determined that children and adolescents who have used drugs should meet for regular one-on-one sessions with a counselor. This could be described as Let's just not be program activity, part of what you're doing. Just part of what you're doing, right? Don't overthink it, right? Stay in the questions, don't overthink it. Okay? I'm gonna let you go, guys. I'm taking my kids out to dinner, hopefully. And we're enjoying our last 2 nights on vacation, and we go back to the real world where it's cold. It has been a pleasure. I will see you next week if I have you scheduled back to my regular schedule.
Thank you.
Thank you. Bye, guys.
Okay.
Thank you.